my colleagues, and my juniors. As we see and have a look around, we see a lot of gadgets in our hands. The technology is advancing. Whether we want or we don't want, we have to go with the time, we have to go with the technology. So now, I think the biggest innovations of the 21st century will be the intersection of biology and technology. These were the words of Steve Jobs, who is the founder of the Apple. So I think for my presentation this was an apt thing, because all we are trying to do in advancement is we are trying to use the technology to improve the health in the world. So when WHO tried to define e-health, they told it is that use of information and communication technologies for health. So the European Association modified it and they invented and added prevention, diagnosis, treatment, monitoring and management. So next, e-health includes telehealth and telemedicine. In my presentation, I may use the word interchangeably because I am concentrating more on the medical aspects. Kindly bear with me. Telehealth basically is clinical and non-clinical services, but telemedicine refers to only the clinical aspects of the services. So now coming to when did this telemedicine start? Actually, Alexander Graham Bell was the person who invented telephone, we all know. Even he used to call his assistant, Mr. Watson, and ask, I have spilled the acid on my trousers, now how do I treat the burns that I sustained? This was the document in the article which was there. And even in the American Civil War, the people used the telegraphs for making the list of mortality and also for the delivering medical services to soldiers. And the Australians used the radios for doing Royal Flying Doctor Service of Australia. This was even used during the World War. Next, we have the NASA, which is using again telemedicine for monitoring the physiological parameters of its astronauts. So now the times are evolved. So this is a picture where I could download from the net, where the ambulance is used, air is there, radios are being used. Next, telemedicine basically is as different categories. I just touch upon few aspects. Here one is store and forward. I am sure most of us would have done that. That is, we take a pic of the thing and then we forward it. It may be for the second opinion or even for sharing the knowledge or for anything. Even in WhatsApp we get so many photographs. Even in forensic medicine, if there's a doubt, we take a pic and put it in the our networks and ask for the opinion. That's also a type of telemedicine. Next, we use for the remote monitoring. Remote monitoring basically means we need to monitor a BP for a patient for a long time. What they do, they connect it to a device that will monitor and that can be viewed by the physician sitting in the hospital. The patient will be at the home. And last one is where we are doing the interactive telemedicine, where the patient is being actually treated with the help of the technology. As healthcare institutions expand and vertically integrate, healthcare delivery is less constrained by geography and even by nationality. This is the actual scenario what is happening now. Next, the available devices today are for, there are so many apps where we can get the treatment. That is like M5, there are so many apps, Practo, where you get the doctor's consultation. As I told, there are devices for recording ECG. Of course, we all know about the gadgets where Apple and all, we can monitor the heart rate, pulse rate, and even there are devices which can monitor your sleep rhythm. So the fourth slide is about the teleradiology, telecardiology, which is being implemented. So next, in the very near future, we'll be getting a Bluetooth stethoscope. We may be getting everything. Once the patient is there, that will be uploaded to the doctor's mobile. That is, in the near future, we will be getting this. Of course, robot-assisted surgeries, then robotics are very much in. So next, In India, at present, Niti Aayog has told that National Health Stack is a virtual digital platform and it aims at providing digital health, that is digitalizing the health records basically, at least by 2022 for all the citizens in the country. In India, ISRO started telemedicine, or it take an active part in it. So just mention the centers which are there. There are so many initiatives and the programs of central government, and even the mobile units are being provided. In Karnataka also we are having, in our hospitals we are implementing e-health. It's coming up, that is phase wise. We are trying to, once a sample is sent to a patient, it will be uploaded, the physician can see it in the OP room. He did not physically wait for the copy and bring it and then show, because time is precious for the patient. So this is in the implementation stage, still going on in Mysore Medical College in Karnataka. I think some error is there. 2 minutes. Okay. Now the private, the Apollo, the Narayana Vidyalaya, and the Shankara Nethralaya and Abhinay Hospital have actually treated, that's the statistics, of 69,000, 64,000 and 54,000 odd patients. This is what I could get from the net. So now I would like to show a video where I just want to show how practically that is happening in India.
In this eye clinic in Andikati village in Tamil Nadu state, patients are seeing things a little differently. Raja Manikam complains about an eye injury, and 15 kilometers away, an ophthalmologist at the Aravind Eye Hospital in the city of Teni diagnoses and treats him. Both are connected through an inexpensive Wi-Fi video conferencing network. It is called telemedicine, and it is increasing access to care in a country that is home to the world's largest number of blind people. 8 vision centers have opened over the past 6 years in Teni district. The centers are run by an ophthalmic assistant who is trained to conduct a full eye examination, administer diagnostic tests, treat simple ailments, and prescribe glasses. A doctor at centers as far as 150 kilometers away gives the final word to villagers.
It is a useful instrument for the villagers. We can actually talk to the doctor directly from here.
Raja Manikam normally would spend a full day traveling to the Aravind Eye Hospital. Instead, he traveled only 3 kilometers by local bus to this vision center in his village. His exam cost about 50 cents, half what it would cost at the hospital. He saved $2 on transportation, which he says he can now use for medicines. The assistant also found a cataract in Raja Manikam's eye, which will require surgery at the hospital. Doctors say this early detection has prevented Raja Manikam from becoming blind. Under the World Health Organization 2020 initiative, India has pledged to eliminate avoidable blindness in 10 years. The WHO reports that about a third of the world's 45 million blind people live in India, and the majority of causes, such as...
Okay, so should I tell the users of telemedicine now? I think all of us can relate it to ourselves in our villages or our native place where this would have seen. Now, who are the stakeholders in this? I just want to bring this slide to know how many people are required to do this, and it's a greater teamwork than the hospital. That is, of course, the patient, doctors, technicians, paramedics, administrators. Administrators play a major role here than what they play in the hospital. I'll just explain why later. Then, of course, teleservice providers, that is the software companies. And the pharma industry, the insurance sector, the policy makers, that's the government, and the law implementing agencies, that is the judiciary. So now, I would like to describe this in 3 things, that is the legal aspects, the ethical aspects, and the administration aspects. There may be a slight overlap in this also. So now I just want to quote one scenario when yesterday Chandru Srinivasa was discussing whether the patient relationship is established or not in video conferencing was the arguing point. So in 2015, a medical board in Texas told that face-to-face relationship is needed to establish a doctor-patient relationship. One of the telemedicine doc, he went and filed a suit. So then, once he filed the suit, the Texas judge gave a stay. They did not give an opinion whether it is possible or not. They referred it to the American Medical Council, who after going through all the aspects, told that relationship can be created through audio or video technology. It is still valid. Of course, it holds good only for USA, not for India. Sorry.